Hello parents, I am Dr.Deepthi, Developmental Pediatrician, Imperial Hospitals, Bhimavaram. We also have a child developmental center here under the name of Happy Kids, where we cater to various kind of neurobehavioral problems like autism, ADHD, dyslexia, global delays, speech delays, etc. So of late we are seeing a lot of cases which are presenting as autism spectrum disorder. Either the parents themselves have the doubt that this child might be having some features of autism, or they were told by some pediatrician or their treating doctor that he has some red flags for autism, or they were already evaluated at some other places with a clear-cut diagnosis of autism. There is a lot of cases which have increased in the post-COVID era, especially that is in the last 3-4 years due to various reasons. But the basic difference that we are noting between the true autism and these kind of children is the main interest in this topic. So most of you, or maybe at least some of you, are aware of the term virtual autism. So what is the difference between a true autism and a virtual autism? So first let us see what does the term virtual means, not real. So this term is being applied to the recent generation of kids who are displaying features of autism, almost very mimicking almost like a true autism, but these symptoms are mainly coming out of their excessive screen times. So the screen times or the virtual world in which they are living day in, day out are resulting in autistic like traits. So they almost look like autism, but there are some major differences. So let's see more in detail about this virtual autism. So before going into virtual autism, so for example, let me take an example. Somebody is very obese, say. So their food habits are very imbalanced, their lifestyle is not good, they are always on the junk food, minimum activity is there, they are always in front of the TV and they are not doing any exercise or anything properly, and so they go on putting on weight and they become obese. On the other hand, there is a child who really has some genetic problem. So he was obese almost from the time he was born, or by the time he was 1 year he was extremely obese, and he was also a bit short, and that continues into his adolescence. So now these are two children who look alike, both of them look obese, but in one the problem is endogenous, that means the problem is from within the body, within his genetics or within his build. Whereas in the other child there was no problem when he was born and he was fairly okay till few years. After that, when his food habits, when his lifestyle, everything changed, then he became obese. So this is a exogenous obesity. So the same way, a true autism child is born with these autistic traits from the beginning, whereas the virtual autism child is completely a normal child till the point he was exposed to this high screen times, and only then the symptoms have developed. So this is one major difference. So we have to find out, because we are addressing the factors which have led to autism. The anxiety levels which are associated. The word autism itself causes a high amount of stress and anxiety in the parents. The moment they hear this word from the doctor, they almost like they are falling into a endless pit. So they are very anxious, they are panicking, they don't know what to do. We have met so many parents who have told that from the moment they have been diagnosed as autism, they have not slept even for a day peacefully, mothers are crying endlessly, the family entire atmosphere has changed, and so on and so forth. For this purpose also, it is very important that we differentiate autism from virtual autism. Some may argue that whether it is virtual or true, it is autism. So it has to be treated. Child has to go to some or other form of therapy. So what is the point in differentiating? So let me answer with an example. See, for example, you go to a doctor with a swelling in your hand which is growing over the last few days. Already you are very stressed that what is this swelling? Is there something very grave about it or something very serious about it, and the moment you go to a doctor and he examines, and if he says maybe this could be cancer, but let's see, let's do a biopsy and see, or let's excise it and see, or something like that, what would be your emotional state? You will freeze, you will panic, you will be extremely anxious. And say the other way, you go to a doctor, he examines it, he says that okay, there is some swelling, so this has to be addressed, but right now it doesn't look like any red flags for cancer. Let's do a small biopsy on this, or maybe let's give a course of antibiotics and see how it responds, and then we can decide about the further course. So in which case you would be more relaxed and ready for the treatment? In both the cases you would go for the treatment. Maybe the biopsy was offered in both the cases, but the way it was conveyed, but the way the ominous things or the rare possibilities were conveyed to you will make the whole lot of difference. The patient ultimately will go for a biopsy and continue the treatment, but the stress levels when they hear the word cancer are almost equivalent to when they hear the word autism. So this is my humble request to all the therapists and the doctors who are dealing with kids on the spectrum, or who are labeling or diagnosing the kids. If you are not sure about the diagnosis, it is better that we tell them that there are some red flags in the behavior, but we need to follow up to actually come to a proper conclusion, for which we need to understand what is the difference between true autism and virtual autism. So with this background, let's go into the topic. So this virtual autism term was actually coined by a Romanian psychologist. His name is Marius Zamfir. So he was working in a hospital in Romania, where they have seen a sudden increase in kids with autistic traits over the last decade. Almost they were following up kids from about 2002 odd to 2010, and they saw that there was an exponential rise in the number of cases they were seeing, which could not be explained by any routine epidemiological trends. So what they did is they went back and checked the medical records and the complete detailed records of all these kids, and what they found was one factor which was common in all these kids was that most of them were exposed to more than 3 hours of screen time on an average daily basis. When they have noted this significant point, they came out with this probability of a virtual autism, and they published a paper also in 2018. This paper was also published, and this included a total study between 2012 to 2017 among a lot of kids in Romania, and they concluded that at 1 year, if the child was exposed to a high screen time, which they put a cutoff as around 3 hours a day, a significant increase in the autism risk at 3 years was noted. However, the main clinching point is that they noted when the screens were taken off and the parents were counseled about this and the play patterns of the child was improved, they saw a sudden shift in behavior again towards the normalcy, which is very unusual in a true autism child. In a true autism child, whatever may be the therapy, it can lead to improvement in the quality of life, in the form of communication, in the form of behaviors, but the core symptoms of autism would remain because it is an inherent problem. But in virtual autism, the converse is happening. When the screens were off, the play was changed, the social interaction has improved, the kids were almost like any other normal kid. They could be integrated into normal schools, and once they grew up, nobody could actually make out the difference between these kids and the normal kids. So with these factors, they came up with this term of virtual autism.